verbiage of performance therapy and applied it in a lot of different avenues, but I think it's kind of gone astray from what our original intent and original philosophy, at least here at ALTIS, with what performance therapy is and how we use it. So by all means, this is not a complete list and there's no particular order, but things I'm going to look at. Performance therapy being equal to trackside therapy, and it's not equal to trackside therapy. When I think of trackside therapy, it really is we're going to bring our tables to the track, set them up, and we'll do therapy on the athletes. And we may not be involved with what's going on in the session. We actually might be far and removed from where the actual work is occurring. Versus performance therapy, in which, for lack of a better word, therapists become coaches and they're using notational analysis with their eyes to see things, looking to see if an athlete has deviated from whatever their norm may be. And if they have deviated, is there appropriate intervention that we could make? And this intervention isn't necessarily clinical in nature, although at times, yes, that it might need to be clinical in nature, but it's more of a quick input into the system to see if we can get them to go back into their normal bandwidth of what they're used to. So we shouldn't be spending 10, 15 minutes on the table. In fact, that could be detrimental, I think, to the overall training session. The reason I say that is the idea of a flow state. Once you get going through your warm-up and you start to find your rhythm, it can be very distracting if the therapist is constantly grabbing you, taking you away from that environment where you're trying to solve puzzles, so there's pieces of the puzzle by yourself, and they start to interrupt that flow state. So when we do pull someone off, there really needs to be a quick input, maybe only one thing that we're looking for, or a one shot, one kill, and get them back on to the pitch or to the track to do their thing, right? So slight difference there. It's not just semantics. I really do think that there's a lot more to it than that. The second thing, okay, we do a muscle test and it tests weak. Now we need to strengthen this. From a performance therapy standpoint, again, if you look at what mainstream media has done with performance therapy, and this is not, again, not necessarily a bad thing, it's just I don't think it's performance therapy. You have a great clinical setup where you have access to the gym, and people are now going from therapy to the weight room, and they're doing some type of meaningful weight exercise as an adjunct to therapy. That's awesome. Again, that's not performance therapy. Remember, performance therapy is that short input that happens in practice or in session. When we come back to the clinical space, we don't have that interaction anymore. If we go back to where we were watching the athletes who have been going through practice and they test weak, is that something we need to strengthen? And I don't necessarily think we jump on that bandwagon right away. You know, there's a lot of different factors that come into play. It can be neurogenic, it can be vascular, as to why a certain muscle group may not be functioning the way we want it to. But it can also be a tissue issue. It can be from the fascial system. Maybe the fascial system is so wound that it won't allow the appropriate effort input into the athlete's biological systems, which would then travel up the motor cortex and get the efferent output. And so what if we did, again, our short intervention from a manual standpoint to correct said dysfunction? That's something that we need to think of. And I think that sometimes we get so far down one stream, we get polarized with the idea that we need to strengthen everything. Well, we need to almost take a step back and look at it from a holistic point of view versus this absolute one or the other kind of methodology. So again, not the whole scenario there, but something we need to be thinking about, right? The last thing we'll kind of touch upon is therapy prior to competition. Now, this kind of goes either way. Some people think that you should have no therapy prior to competition, and others think that you can have as much as almost you need. Of course, those are two very different ends of the spectrum, and we need to find the rational middle to that. Do I think that therapy prior to competition is bad? Absolutely not. Remember, we've been conducting performance therapy throughout the year. The therapist has developed a really good relationship with that athlete, and they know the type of movements that they're capable of going through, and when something is a little bit off or a little bit outside that bandwidth of normal for that athlete, a small input prior to the competition could give us that competitive advantage. So in that case, it is in fact needed, and it's valid to do such a thing. Now, on the other end of the spectrum, is too much therapy a bad idea? Well, yes, absolutely. We don't want to invoke so much signal or noise into this ecosystem of the athlete prior to the competition. We know they have a lot of other factors that are going on. stress level would be one of those things. But doing too much could actually, again, cause an athlete not to have the correct puzzle pieces and deviate from their race plan, which again would probably show in a poor performance potentially. We also don't want to try something new during that race week. Therapy intervention should be pretty close to what they're normally getting. You're almost creating this system of what they're used to, right? So it's definitely a check and balance that we have to kind of manage. But from a performance therapy perspective, I think therapy prior to a competition is something that you can definitely go through as long as it's an intelligent approach. Cool.